You're listening to OET Roleplay Practice with Kev, the English native.
Hello, it's Kevin here. Time for another OET speaking roleplay for you to practice with. Another one for the pharmacists among you. It's been a couple of weeks now since I did my last role play. I'm trying to do them every week, but I'm so busy these days on my students on italki. And most of them currently are doctors, so I'm doing OET for medicine. I've made a lot of new material, some speaking phrase bank books, some new writing sentence frameworks, quite a lot of things actually. All of which will be available. You'll see the link below to contact me, or just go to theenglishnative.com. All my links are there. So now in this episode, it's interesting. It's a request for sleeping pills, sleeping tablet prescription. Pretty straightforward. Not so much there, but you'll hear the different phrases. You'll hear how the pharmacist provides structure, asks questions, gives information, etc. Now, in the coming episodes, which I'll be hopefully working on the rest of the week, I'm going to do another nursing one and another medicine role play. You can find these on YouTube as well as here on Spotify. Transcripts available for all episodes, and I've got lots of videos on my channel on YouTube, The English Native, about how to use these, how to use AI for both writing and speaking. And I've been making so many new materials. I'm currently working on the course book for medicine and nursing. So it's going to be like a phrase bank book with the transcripts based on these episodes that you will find here on Spotify. So that's exciting stuff. It's taking me time, but it's upcoming. Anyway, that's enough from me. Let's have a listen to the episode. I only did it in one version because the my latest pharmacist student was a man. I don't usually get pharmacists, so I only did a male version. The next few for the doctors and nurses, I'll be doing both male and female versions as usual. Anyway, have a listen.
Hello, I'm Kevin, the pharmacist. How can I help you today?
Hi, I'm here to collect some sleeping tablets my doctor prescribed.
Of course. Can I confirm your name and date of birth, please?
Yes, it's Janet Daly, 5th of the 7th, 66.
Thanks. While I get that ready, can I ask what's been happening with your sleep?
I've had trouble sleeping for a few months. I just can't get a proper night's sleep.
That sounds exhausting. Sorry you've been dealing with that. Is it mainly that you can't fall asleep, or you wake up during the night, or both?
Mostly falling asleep. I lie there for ages, and sometimes I wake up really early and can't get back to sleep.
Okay. And is that most nights now?
Yeah, most nights.
Right. Just a couple of quick safety checks so I can advise properly. Do you have any health conditions?
No, none.
Any long-term medication, prescription, or over-the-counter, vitamins, or herbal products?
No, I'm not taking anything regularly.
Have you used sleeping tablets before?
No, never.
Thanks. Do you drink alcohol in the evening sometimes?
Maybe a glass of wine now and then. Not every night.
Okay. And do you drive in the mornings, or need to be very alert for work?
Yes, I drive to work.
Good to know. I'll be extra clear about drowsiness. So, with these tablets, the key thing is timing. Take it right before bed when you're ready to sleep, not earlier in the evening. And only take it when you can give yourself a full night, around 7 to 8 hours, so you're less likely to feel groggy in the morning.
All right.
Also, they're usually intended for short-term use, or only when needed, rather than automatically every night for weeks. Your doctor's instructions come first, of course, but that's the general approach.
Okay.
A few important safety points. First, avoid alcohol on nights you take it. Alcohol can make the sedative effect stronger and increase the risk of dizziness or falls.
Right. No wine on those nights.
Exactly. Second, be careful getting up in the night. Move slowly, hold on to something, because it can make you unsteady, especially at the beginning.
Okay.
Third, because you drive, if you feel drowsy, slowed down, or hungover the next morning, don't drive until you feel normal again. Some people feel fine. Others feel sleepy the next day at first.
Yeah, that worries me a bit.
That's completely reasonable. Possible side effects include dizziness, headache, dry mouth, sometimes memory or concentration problems, and prolonged drowsiness. Not everyone gets these, but it's good to know what to watch for.
Okay.
What questions or concerns do you have about taking them?
Well, my daughter's a nurse, and she told me some sleeping tablets are actually antidepressants. So I wanted to ask, is what I've been prescribed an antidepressant?
Yes, good question. Some medicines that are classified as antidepressants are also used to help with sleep because they have a sedating effect. In your case, the prescription is for a medicine in that category, but at a low dose, it's being used to treat insomnia, not depression.
So it is an antidepressant then?
Technically, yes. But using it for sleep doesn't mean your doctor thinks you're depressed. It's about the effect it has. At lower doses, it can make you drowsy and help you sleep through the night.
I really don't want to take antidepressants. I'm not depressed, and I'm worried I might become dependent on them.
I understand. Let me reassure you. First, the dose used for sleep is usually lower than the dose used to treat depression. Second, these sedating antidepressants, when used for insomnia, are not generally associated with the same kind of dependence that some traditional sleeping tablets can cause.
So I won't get addicted?
The risk is low, especially if you use it short-term or intermittently and exactly as prescribed. The main thing is not to start increasing the dose on your own, and not to use it as the only strategy. Sleep habits matter too.
Okay.
If you ever feel you need it every night for a long time, or you feel you can't sleep without it, that's a good point to speak to your doctor so the plan can be reviewed safely.
Right.
Because this has been going on for a few months, I'd also recommend booking a follow-up appointment with your doctor. They can look at possible causes: stress, caffeine, pain, reflux, routines, and talk about longer-term options.
Yeah, I probably should.
In the meantime, a couple of simple things that can help. Keep a consistent wake-up time, reduce screens before bed, and avoid caffeine later in the day. Even small changes can improve sleep over a few weeks.
I'll try that.
Great. Just to make sure I explained everything clearly, when will you take the tablet?
Right before bed, when I'm ready to sleep, and only if I need it.
Perfect. And alcohol?
Avoid it on the nights I take it.
Exactly. And if you feel drowsy the next morning?
Don't drive until I feel normal.
Spot on. How are you feeling about taking them now?
A bit more reassured, actually. I was really worried about the antidepressant thing.
I'm glad we cleared that up. Are you happy to try them as prescribed? And if you still feel unsure, to speak with your doctor about it.
Yes, I'll try them, and I'll think about making an appointment to talk to my doctor.
Perfect. And please come back or call us if you notice side effects that worry you, or if your sleep doesn't improve. Then we can talk through options and what to do next.
Okay, thank you.
You're welcome. Take care, and I hope you get some proper rest soon.
So there you go. I hope that was useful, informative, as always. So there'll be a link below to my learning management system on Notion, where you can download the transcript. And again, there's links to my videos, other podcasts. This one, my profile on LinkedIn, where I publish a lot of my research and articles about OET and IELTS, etc. So I hope that helped, and I'll see you for the next episode.
Thanks for listening to OET Roleplay Practice with the English Native. Join me next time for more practice and tips.